Everybody, Chad here live at Bootcamp. I'm with Terry with LightForce.
Yes, hi, Terry Ahsing, LightForce Lasers.
Yep. And what we're going to do right now is a demonstration. LightForce is here with us. As many of you know, I've had a chronic condition in my left shoulder with me for my entire adult life. We're going to treat it here right now. If you are here with us at Bootcamp in San Diego, I want you to come by and see Terry. By the way, Terry's a little modest about this, but he has an amazing story. He's been in the PT business for 43 years.
43 years.
43 years. He knows the industry inside and out. He knows everything there is to know with regards to research for just about any modality that you can think of, and he is on the cutting edge of what they're doing with lasers in regards to therapeutic applications.
Absolutely. So I've been involved in development and scientific research and looking at everything from the TENS business when I first got involved with developing a square wave TENS device back in the 70s. And we also worked with Rancho Amigos Hospital, Dr. Lucinda Baker, on developing neuromuscular stimulation techniques, is also helping to fund their research in that area. I was one of the founders of IOMED, so we did a lot of research on transdermal delivery of solutions through the skin. And I've also founded a cardiology company which did a lot of research on wireless telemetry. So I'm pretty familiar with the research and applications. I must admit, I've been involved in every modality in physical therapy since its inception in the 70s. The only one I wasn't involved with is one that predated me, which was galvanic stim. So prior to that. So what we're going to do is this is our 15 watt laser. We have a 9, 15, and 25 watt laser. And this is a class 4 laser, which is the classification of lasers that what we consider high powered lasers. And they run the gamut, everything from therapeutic lasers up to industrial lasers. The majority of the laser research and the majority of the laser applications in physical medicine are based on class 3 lasers. And class 3 lasers are less than half a watt of energy by classification. So this is on the order of 30 to 50 times more energy delivered, joules of energy delivered to the tissue. So we commonly refer to it as deep tissue laser. So for that reason, most of the research that was done on class 3 lasers were done for surface conditions like wound healing. Very effective, but not as effective for deep tissues as it would be at a higher watt. So what we'd like to do is take your shirt up, if you would. So the difference is really the delivery is over a greater area. Since we deliver more wattage over a very short period of time, we're able to treat large areas, and you should always try to treat as much of the referred areas, try to get as much range of motion, treat areas around the entire condition so that we're not isolating and treating just a trigger point over a short period of time. So we can treat an entire upper extremity in 10 to 15 minutes, whereas you would take 200 or 300 minutes to do that with a 3B laser. So it's critical to the results of essentially flooding the cell with photonic energy, and that affects a change in the cell itself, in the chromophore of the cell. So what we're trying to do is affect that change, which expedites healing, speeds up recovery. So we're trying to get the system to basically heal itself as quickly as possible. Some of the benefits are that we can treat conditions immediate post-trauma, and we can do it immediate post-surgical, unlike other modalities, which is really important. So what we'll do is...
Want to give them a pre-test?
A pre-test?
Yeah.
We could.
So just classically, when I do that, I get pain pretty much radiating up and down cervical spine into my chest, and also even down into my arm a little bit.
Yes. So we have an aiming beam, so we can actually see the area that we're treating. I'm going to be using a technique. We have a proprietary application head, which is a massage ball. What that does is it allows you to make contact with the skin, which normally when you're using laser therapy, you're an off-contact application. So this is one that we can treat directly on the tissue. We can also, when we apply pressure to the tissue, it shortens the distance to depth, so we actually can deliver more energy to depth than we normally would with a non-contact application. So what we want to do is we want to start an emission therapy by working slowly through the area and make sure that you're moving the head at a pace that allows for delivery. But since melanin is a great absorption tissue along with water, for laser therapy, we have to make sure that we don't heat the tissue and melanin, especially in dark-skinned individuals, or over very dark tattoos. This tattoo is not very dark, so we're able to treat over that area, which is very good. And so, generally, if we had a very dark skin or some area that was darker, then the system actually, when we set up the device, we have two wave forms, two wavelengths of laser energy, and we can adjust that. The unit does that automatically as soon as you indicate what the color of the tissue is and how much tissue we're treating. So we can actually determine fairly quickly what wavelength should be used most effectively. So what we're going to do, and we should always try to do, is do some active range while you're treating. So go ahead and that limitation area that you indicated, and continually do that. We'll see what we can do to increase that. Take that off if you don't mind. Just rub it in the way. And how is that feeling?
Actually better.
Comfortable warmth?
Yeah.
Okay. Well, we knew it would get better. I was just wondering about the
Yeah, it's comfortable.
comfortable. Good. People always want to make sure that their understanding of laser, right, is that it's limited generally, and so we do remind them that it's a warming sensation. Should feel very comfortable. If at any time it's not comfortable, just let us know, because we want to make sure that we're always treating within a comfortable range. But you can see that we're doing, just based on the indication that we want to try and get to the structures that might cause some referred discomfort. Treat that. You indicated that you also had that little shoulder.
Yeah. Some classic impingement.
Classic impingement, yes. So you can really just do that with a high power laser that you can't normally do with other types of lasers. Okay, let's see about range again. Better. We'll just put that right there. So the average treatment for, neck, shoulder area would be, somewhere around 7 to 9 minutes or so of active treatment. So it's a very quick therapy, which really lends itself well to, you can do either before therapy or after therapy. You can either help the patient loosen up prior to your rehab, or you can send them home happy. So it's kind of or you can do both. So generally there's a formula, and we'll cover that with you whenever we do installation and application. Our company does on-site training for all of your therapists to show them the proper application and some of the safety and indication cautions, and there are very few, so we just want to make sure we always cover that very carefully. But we do that for every unit that we place, and we also make sure that we have everyone fully comfortable with therapy.
Excuse me. Go ahead and edit that out.
So how we go? Good. So the formula that we generally do, just so that you know, is we look at about, we want to deliver through about a 100 square centimeters, a centimeter squared area, which is about the size of a DVD. Is we want to work that area during the course of the protocol treatment that's indicated. So we have a protocol-driven technique that used in all of our units that you can just drive all of your therapy using the protocols that are built in. They're usually pretty conservative, or you can just do a direct operation as I did and just treat, you know, as much wattage as you want within the capacity of the unit over the area that you treat.
Yep. Okay, so two things I want you to talk with Terry about this weekend if you're here in San Diego with us. One, I want you to ask him about the other applications that this device has and laser therapy has that I didn't even know about. He'll know exactly what I'm talking about there. And the other one is that what they're doing is they're helping practice owners use this as a back-end cash pay service. So I want you to ask about that model, ask them about the different applications. I'll give you a hint. One is diabetic neuropathy. You need to look into that. At least we see a ton of it. You're going to want to ask Terry about that here. Also, and who's the other gentleman with you, Dave?
Dave, yes.
Dave. See Terry and Dave, ask them about that, and also how they're helping therapists set up back-end cash pay services. So
Very, the heart of our business. We have a very good marketing system that we've developed called the Compass system that you get with our device, which helps you to market the cash paid business as well as generating new revenue channels. So we're aligned very carefully and closely with our partner now because we believe that we're really telling the same story, us using modalities, you using a great marketing position, and we think that it's going to be a great marriage between the two.
awesome.
Thank you.
Thanks for being here, Terry.
You bet, my pleasure.
Check out Terry.
Check us out.